kinda crazy out there, the way things be. People dying while in police custody, or even worse, getting shot. Systemic racism gone wild, police out of control, putting all the brothers in a chokehold. So many lives, so many died, so many taken. Police accountability, yes sir, at last. Defund the police and put the money in the hood, and maybe things will start to be good. But until then,
hello and
we
welcome
don't want to hear no
to this
chatter.
new podcast of the American Journal of Public Health. I have to tell you today the background is a little bit different because I'm doing this from my office in DC, and this is the office at the Journal, and I just wanted to show you one of my walls. It's like that all over. I have about 10 years of covers that are all over my walls. Today we are going to be talking about injuries and deaths from shooting by U.S. police. We have prepared this podcast with my dear co-host, Vickie Mays. Hello, Vickie. We conceived the podcast together. We decide on the theme. We invite the participants. So it's a joint activity between Vickie and I. And today we've decided to talk about the very interesting and novel articles that we just published in the American Journal of Public Health about injuries and deaths from shootings by U.S. police. I mean, there's a lot of concerns about the consequences of shootings by U.S. police, but how many of you know that most of the information we've been discussing till now were only a fraction of all the consequences of those shootings? We've been talking about deaths, but some of those shootings, produce injuries that are not fatal. And they are also extremely important. And actually, what Julie Ward and her colleagues show is that those fatal deaths represent only a fraction of the total number of injuries and, injured consequences, whether fatal or not, of these shootings. So we wanted to discuss, first of all, to bring this information to all of you, explain how it was obtained, and also discuss how we should continue to monitor them, and maybe also how we could prevent them. So in this podcast, we have Guy Seymour, we have Julie Ward, and we have Brandon Del Pozo. And I'm going to ask our guests to introduce themselves briefly, and then we'll start the conversation. Guy, please start.
Hi, my name is Guy Seymour. I'm the managing partner of Psychologists in Public Safety, which is a consulting group that works mostly with police agencies and emergency management agencies. I've been a police psychologist for about 25 years now and worked mostly with the Boston Police and the Atlanta Police, and as a full-time person on the command staff, so that very often whenever we had a police shooting, the information would come to the command staff and we'd review it and then decide what are we going to do with the officers that were involved.
Thank you very much, Guy. Julie Ward.
Sure. Good morning. So first, thank you so much for having me. I've really been looking forward to this conversation this week. My name is Julie Ward. I am an assistant professor of medicine, health, and society and public policy studies at Vanderbilt University, and I am also a registered nurse. So my nursing expertise has largely been in the realm of occupational and environmental health, and my doctoral training and expertise is in public health and specifically injury and violence prevention. My research focuses on opportunities and strategies to improve public health and safety systems for the prevention of injury and violence-related trauma in community spaces especially. And within that, I do a lot of work on firearm policy, firearm ownership, perceptions of safety, equity and injury prevention, and then, of course, shootings by police, which we are here to talk about today.
Thank you very much, Julie. Brandon, please.
Hey, thanks for having me. It's always wonderful to have these conversations with the journal. My name is Brandon Del Pozo. I'm an assistant professor of medicine and public health at Brown University and Rhode Island Hospital. My research concerns health and the justice system, but specifically policing, usually addiction and overdose, sometimes police use of force and violence. Prior to that, I was a police officer for 23 years. I did 19 years in the New York City Police Department, where I commanded two police precincts and rose to an executive rank, and then 4 years as the chief of police of Burlington, Vermont.
Thank you very much, Brandon. Thank you all for being here again. Thank you for the time. I wanted to start with you, Julie. Tell us about, what brought you to study these questions and what were the challenges you faced by trying to assemble this data, analyze them?
This research that my co-authors and I present in this article has honestly been several years in the making. I think a lot of people don't realize this, but policing agencies are actually not required to report to the federal government when officers use their weapons. And this is a problem that researchers, not just in public health, but also in the field of criminology and criminal justice studies, have been raising alarms about for over 20 years now. Because we have lacked a reliable federal data source, researchers have come to largely depend on online repositories of media reports of these shootings. And we have good evidence to support that those are reliable sources and a better option, largely because these are seen as such newsworthy events. Most of those sources, the online repositories, only count deaths. And in fact, all of them except for one only count deaths. And that one that includes non-fatal injuries has unfortunately been pretty cumbersome for researchers to use. We used it as our starting point. So we have had some great studies of fatal injuries nationally, but we have honestly had no idea how many times people have been non-fatally injured. And the incredible thing is the difference between a fatal shooting and a serious injury from a shooting is sometimes just a question of centimeters. And as I said before, we have had no idea on a national scale how often those non-fatal injurious shootings by police occur. And that's been really limiting, I think, for motivating movement towards solutions. By only being able to look at half the picture, as it turns out, we've really exaggerated the rareness of these events. So my team wanted to find out how often and in what circumstances police fire their weapon and injure a non-officer, either fatally or non-fatally. To answer that question, it took a large team, about 15 students and researchers and counting. We are continuing this work. It took that team several years to read through all of the events and the publicly available materials that we could find on thousands of, quote, officer-involved shootings listed in the Gun Violence Archive, which is a pretty broad category in that source. So it took several rounds of reviewing these incidents to first find the cases that met that responded to the question we were asking, right? Officers using their weapon and injuring a non-officer. And then several additional rounds of reviewing those incidents to pull out details on those shootings and the victims involved. I personally painstakingly reviewed materials on at least 6,000 shootings at this point. So collectively as a team, we read through those cases and created from that an improved data set that allows us to analyze the circumstances of those shootings. And as I said, importantly, also the characteristics of the people injured in them. And right now that data set spans 6 years, and we're working to extend it into a 7th.
Fantastic. Thank you very much. This is an incredible work and so useful. So, Brandon, why do we have so many trouble to, collect information on those shootings? They are a major public health issue. So why and how could we make Julie's work easier?
That's a great question and an important one. And one of the things that struck me as I moved away from being a leader in 2 police agencies to being a researcher with a broader lens is how heterogeneous the U.S. policing profession is and how disparate it is and how little control the federal government has over the reporting requirements and behaviors of police agencies, their policies, et cetera. Not only are police agencies under no requirement to report police shootings to the federal government. They're under no requirement to participate in like very common crime reporting protocols like the UCR reports. That is at the state and municipal level. Just simply reporting crime to the federal government is voluntary among police agencies. So considering that that's, often a less thorny issue than police shootings, it's no surprise that there's such poor participation. But I will say this, there's a lot of police agencies that do an excellent job of tracking their own police shootings. The question is, how do you generalize that and then aggregate it to the federal level? For example, New York City not only tracks all police shootings, but they track every incident where a police officer fires the weapon, whether it hits anything, whether it hurts anyone, and whether it kills anyone. They've all been systematically documented for decades with every sort of variable of interest, right? Same thing with Chicago, with Los Angeles. I think a big gap is that although police shootings are much more common than the research suggests, at the agency level, they can still be fairly infrequent. So you have like LA, Chicago, New York really tracking their shootings in a way that if you had their data, it would be complete for decades. But then agencies that have shootings once every few years, right? That aggregates to a big number. Those agencies are probably never reporting that out anywhere. And capturing those small agencies is going to be a way to get like true insight into the scope of police shootings. And that's a big challenge. I don't have an answer for you yet. Maybe we can explore it during the podcast.
So, in this case, what type of information would you like to see, Brandon, if we had the proper monitoring system?
I mean, that's such a rich question, and I'd love to hear what, if Julie's read thousands of these, I'd love to hear her thoughts. But, in my mind, as a person who had the responsibility of leading police, I am interested in the police shootings that would not have happened but for discrete decisions made by the officers, right? There are some shootings that are interventions that are tragic but necessary to stop a much worse thing from happening, to not maybe only protect a police officer's life, but to protect the life of citizens or students or people at a mall, God forbid, right? But there are so many shootings that happen because a police officer decided to stop a car, approach the car in a certain way, made decisions. We call it in policing officer created jeopardy, meaning the officer manufactures the jeopardy that leads to the use of force through escalation rather than de-escalation, through a poor choice of tactics, through just not engaging with someone in a safe way, or choosing to engage when they didn't even need to. So in the broadest sense, I'd want to capture data that gives insight into what shootings happen because officers created the jeopardy. Because then you could really start making interventions that reduce the frequency of those shootings. And I think that could take a sizable chunk out of the volume.
That's great. So it seems, Guy, you're needed on board in order to get a proper monitoring system, because this is the type of information you get.
Yes. And I wanted to jump in and just say that and in the two large departments that I worked with, and I was also a consultant to about 50 small police departments, the issues are frequently the things that lead to police firing their weapons are frequently officer characteristics or training characteristics. And what we did when I was with Atlanta is we spent a lot of time at the police academy reviewing each use of force. Well, not use of force, because we weren't looking at tasers and non-lethal, less lethal weapons, but all the firearm uses. And many times it was the officer's own insecurity or anxiety in the situation, or in many instances, their own throwback to domestic violence situations that they were victims in when they were younger, part of which encouraged them to get into policing. but it was their experience that created the conditions for the manufacturing of the jeopardy. I think Julie's research, or maybe not, needs to look at more of the officer involved characteristics.
Let me really jump in here because are you all saying that training would cause much of this to go away? Are you saying that better assessment when we hire officers could make this all go away? Because it sounds like we've got this kind of person error, So what is the real opportunity? I mean, again, I'm also a psychologist. So what is a real opportunity to change people's behavior from something that they bring to us that is very deep-seated?
And I think that we have theories about what explains the variance in police shootings. We have plausible theories about what explains the variance, but we don't know the extent to which each discreetly explains a certain amount of the variance for a few reasons. One of the reasons is why Julie's with us today, right? Because we don't have the N that gives us the prevalence and the correlates to certain policies, to certain hiring decisions. And I think what we'd find is there's a stark difference in fatal police shootings by rate, by state, and by city. For example, New Mexico had this totally out of proportion number of police killings. New York City, for a big roiling city with a tremendous population and a lot of complexity, has a very, very, very low rate. And my thinking is that a lot of that has to do with training, with expectations, but we can't really sink our teeth into it until we have the data that allows us to examine variance. And we don't. It would be such a rich topic for research.
Yes, it would. And also, I think it's important for us to look at what is done in the training academies, because I think the training frequently leads officers to over-anticipate danger and therefore to use force more often rather than training them how to reduce their sense of threat.
I think back to one of Brandon's initial points, talking about the large agencies versus the small agencies. And I think that also comes into play to an extent in your example of New Mexico and New York. We shouldn't lose sight of the fact that most of our policing agencies are those small agencies. So those incidents add up. And to this question of behavior and training, I think there is a fundamental difference in the foundational orientation of policing, which is what I think Guy started to speak to, that is also involved here, and as well as social and policy contexts in the places where policing occur. And I would, I think, call attention to the issue of, sure, behavior and decisions are one thing, but we're public health. We should be looking another layer upstream and asking whether police ought to be or are the best responders in all of these situations that we're looking at. And I think we see from this work that's presented this month, we were amazed to see that the number of events that involve behavioral health needs, almost a quarter of shootings, 23%. And these are situations where people were experiencing an exacerbation of a mental illness diagnosis, or were under the influence of substances, for example. And those incidents tended to be more lethal than situations where such needs were not described. So there is a pattern that we've seen in this country where, for some people, when they are experiencing a public health issue or a behavioral health need in this case, they get a public health response. And for others who may be experiencing a similar issue, they instead get a policing or more punitive response. And part of what we're seeing in this research now is the human impact of those collective decisions that we've made, right, in terms of injury, those decisions to rely as much as we do on a policing response nationally.
Yeah, this is a key aspect, I think, of the problem. Can community organization, can community groups, etc., replace the police when we are dealing with, alcohol, intoxication, or mental health problems, etc.? So what do you say, Guy? I think it's a question for you. Shouldn't we transfer some of the police activity into other sector of society.
Yes, and in fact, some of the work that my company is doing is to work with police departments to include mental health specialists in their response. The problem is, and I haven't been able to figure out how to get around it, the problem is with dispatch. 911 gets a call. The dispatcher who transmits it to the officers on the street makes the sense of danger greater than it probably ought to be. So that when officers arrive on scene, they're primed to be prepared to use a weapon of one kind or another, and in many instances, just a firearm. So we need to change that. We also need to change the supervision process, because supervisors are frequently not on the scene of these shootings. Now, people say, well, they happen so fast, you couldn't get a supervisor there, if they were flying. But it's not true. In many instances, we've seen that you could have gotten a supervisor on the scene. That original conversation between the officer and the subject who becomes the victim takes a few minutes, more than a few minutes in many instances. But our supervisors are not prepared to respond that way.
Yeah, I've also, we cannot talk about this question without mentioning, the overrepresentation of minorities among the people injured or killed, in particular people of color. So part of the problem may be due to the fact that the police officer doesn't really understand or know the community, and therefore engage in a violent behavior, whereas they could have been a different approach if it was a community member who knew well the community and its members. So what do you think, Brandon?
Yeah, I was thinking, I was talking to some actually attorneys about a case in Pontiac, Michigan, where, Pontiac is really an all-black city, meaning overwhelmingly African American, and it's policed by a county sheriff that has very few black deputies, and it is the worst example of that stereotype of like an occupying army coming in, and that's like example that's very stark. But to the extent that problem persists in the thousands of smaller agencies that Julie mentioned, like add up when it comes to shootings. It's a real problem. In New York City, it's a majority non-white police force, right? But when you look at Ferguson, Missouri is another classic example. It's a largely white outside of the city department coming in to police the city. Like there's all sorts of cultural problems with that. There's all sorts of competence problems with that. And just to echo, Julie is completely correct. The average police department is small in comparison to the ones we think of. So my point was, New York City isn't engaging in rocket science when it investigates and reports out on its police shootings. It just has a different constituency and a different type of accountability. And these small agencies often don't have a vocal constituency and don't have the right mechanisms of accountability. And so it's in their interest politically just to sweep the shootings under the rug once they disappear from the news cycle. And that's a tremendous problem. It's a matter of democratic accountability to keep track of who you're shooting if you're the government.
Absolutely. Listen, we're getting unfortunately till the end of this podcast. I want to say that we did that because we were really interested in how to monitor the deaths and the killings and the injuries, but also to find solution. The cover of the journal has a die-in demonstration represented there because it's also part of a way of finding a non-violent answer to that situation. So, Vickie, have we achieved our goal with this conversation?
I think we have, in the sense of raising where the issues belong, which often is not in the police department, but it's in other contexts of, who supervises the police, the extent to which mayors and governors, can take action. I think that, I want to pose this final question, which is, let us assume that, the federal government in the form of CDC or others will listen to this podcast. What would be your wish for data that you think could, now the issue of feasibility, I think, is really where Brandon started in the beginning, which is, you put a heavy burden on a very small department, even though that may be the source of the biggest problem, it's not going to get done, So how do we do this in order to meet your data needs so that public health can really be stood up in this? What's your request?
I would say that we need to request more research on more officer characteristics, a lot of it on their prior to policing histories, because what I've seen is that a lot of officers come to policing because of their own trauma history, and they walk around with that trauma history all the time, and it increases their sense of being under threat. And I think that's where Brandon's research has a lot more to offer.
Brandon, so what's your wish?
Two things. One, sergeants, Guy is right. Sergeants have a tremendous influence over the behavioral expectations of police officers. A lot of my preliminary and even more involved research bears that out in different settings. So that could be a leverage point for reducing incidents of shootings. But this podcast is about the measurement of shootings. To be policy wonkish for a bit, I think it's very hard to move the federal needle on this. There's fierce resistance to the federalization of U.S. policing. But at the state level, there's been a lot of success or comparative success in getting a state can mandate that its constituent municipal police agencies report shootings. I believe California does that. I know other states do it. States do it in mandating crime reporting to the FBI. So at the state level, if we could leverage attorneys general and leverage state legislatures to create state legislation to report police shootings, that can eventually aggregate into a better national picture. And it seems like politically it's more feasible than a federal rule.
Great point. Thank you, Brandon. And final words, you have the final words, Julie, and you really deserve it. You wrote such a great article that we were so proud to publish. So please let us know your point of it.
Thank you so much. I appreciate all of these points and recommendations. I think I would underscore that I think we're all agreeing the use of deadly force is a unique and important responsibility that has been given to police. And I appreciate the burden that comes with paperwork. Believe me, I come from healthcare. I understand what that's like. But we really ought to know how often this power is used and the impact that it has on people's lives. And we should have a full definition of deadly force in that pursuit. So we have a better understanding now of fatal injuries and non-fatal injuries, but the use of a weapon and other forms of deadly force are also still deadly force. And we should know when injuries don't happen as well to be able to identify better opportunities for prevention. So that's what I would like to see. And as we've attempted to do here, understanding the situations that are precipitating these events and the people that are affected by these events.
Thank you. Listen, here we are. Thank you all. Thank you for your time. Thank you for your great work. Thank you, Vickie, for hosting this with me. Always a great pleasure. And hope to see you soon again. Bye-bye, everybody.
Nobody should be treated like that. Every time you look around, there's some police brutality going down. And it's kind of crazy out there, the way things be. People dying while in police custody, or even worse, getting shot while in full compliance in that illegal traffic stop. Systemic racism going wild, police out of control, putting all the brothers in a chokehold. So many lives, so many died, so many taken. Policies and procedures so long forsaken. But 846 got the whole damn world on fire. The time to rise is now, and so be it. Change is coming real fast. Police accountability, yes sir, at last. Defund the police and put the money in the hood, and maybe things will start to be good. But until then, we don't want to hear no chatter, cause every day in the world, Black Lives Matter.
Fighting for your rights. Don't you stop fighting for your rights. Get up, get up. Get up, get up. Don't stop. Get up, get up. Don't stop. Get up, get up. Don't you stop fighting for your rights. Don't you stop fighting for your rights. Come on. Don't you stop fighting for your rights. Get up now. Come on, get up.